welcome. Thanks for tuning in to another one of those special webinars where we talk about Samajhdar Bano Sehat Ke Ishare Samjho. This is a little segment where through dialogue and through very nice conversations, and we've got an esteemed set of panelists, I'm going to soon be introducing them to you. We talk about how all of us can collectively, with the small measures and the small things and details that we can do about our lifestyles, about our daily routines, we can beat diabetes, and by beating diabetes, we can win life. This is a CSR initiative by USV, and let's get cracking on here, because you see, when we need to measure our waste, we're not only measuring our waste, we're sort of indirectly protecting our future. Across the country, non-communicable diseases such as type 2 diabetes, heart disease, high blood pressure, they're all rising steadily. And what is important to understand is that these very conditions, they develop gradually, sometimes even silently, over the years before finally any symptoms can appear. And the recent ICMR India B national study conducted across all states and union territories, it shows that a significant proportion of Indian adults are at a metabolic risk. There is a metabolic alarm bell that's ringing, even when they do not appear overweight or appear overweight or obese by body weight alone. And that tells us something very important. We're going to break that down for you. Body weight does not always reflect internal health. That's right. Whilst no single measure can predict disease on its own, waist measurement is an easy, it's a low-cost screening tool that can help identify risk early. Today, we focus on that very simple step, measuring your waist. With us on the broadcast, Dr. Jayashree Gopal, MBBS, American Board Certified in Internal Medicine, Endocrinology and Diabetes, Director, DiabEndoIndia Institute for Diabetes, Endocrine, Metabolic and Lifestyle Health, Chennai. The list goes on and on. I've had to bridge this down for the viewers here. Many thanks for taking out the time, Doctor. Next up, we've got Dr. Jyoti Sharma, DM Endocrinology, Adult and Pediatric Endocrinologist, Forbaxy Hospital, joining us from Jaipur. Many thanks for taking out the time, Dr. Sharma. And finally, finishing up the list is Dr. Nautiyal, Dr. Manishi Nautiyal, DM Endocrinology, DNB General Medicine, MBBS Consultant Endocrinologist, SL Raheja, Fortis Hospital, Mahim, Mumbai. You're war veterans yourself. You know, when we're introducing, war and defense strategy experts, the list goes on and kind of ranks and medals that they have. The same goes with all of your doctors as well. And let's quickly begin the snowball here, talking about our waistline. Let me get the snowball rolling here. We've got with us Dr. Gopal. Dr. Gopal, if my weight is normal, okay, the silhouette of my clothing, it looks good in the mirror before I step out of the house, why should I measure my waist? Let's start simple. Let's tell the viewers how, by a simple technique, simple tools, just by measuring your waist, it can tell you a lot about what's happening inside your body.
Yeah, hi. I think this is something very important that all of us need to be aware of. It's not just important to look slim. Your waistline also has to be a certain level, below a certain level, because it's not just about having excess fat and looking fat to the outside world. Even accumulation of a little bit of fat around the waist increases the risk of problems like diabetes, blood pressure, and cholesterol. So that is the reason why it's not just your tailor who should be measuring your waist. I think we should also start measuring our waists.
All right. Dr. Sharma, what makes fat around the waist more harmful? There are many people who accumulate fat on their legs, on their arms, but it's the waist area that people should be most, concerned about, but that's not always the case.
The abdominal fat basically surrounds major body organs like liver, like pancreas, and this fat interferes with the body's ability to utilize insulin and then therefore to regulate blood glucose levels. And with time, this fat will lead to increase in the risk of major health problems like type 2 diabetes, like heart diseases, like lipid metabolism disorders. So, as you said, we need to measure the weight, and if that is waist size, and if that is increasing, then that is a early cautionary sign. It's an early warning sign, and we should not ignore that.
Dr. Nautiyal, we love our food. We love our carb-rich diets. Is this something that's problematic to the Southeast Asians and more focusedly on Indians? Is this problem more common in Indians, doctor?
Yes, definitely. So in India, basically abdominal obesity at a normal BMI is very common, and this is referred to as thin fat Indian phenotype. And we have data which has shown that 40% Indian women and 12% men have abdominal obesity at normal BMI. So we should not assume that we are healthy just because we are not overweight, as there are so many other parameters beyond BMI which defines obesity. So today we are discussing one of those, that is waist circumference.
All right, all right. You know what, Dr. Gopal, seems like, and let's be honest for all our viewers here, we only check our waist when the jeans or when our, bottom wears stop fitting. And I think by then it's already too late. And then there's nothing quite really lovable about our love handle. So we need to keep all of that in check. What is considered, Dr. Gopal, a healthy waist size for Indians, for men and for women?
So for women, a waist circumference below 80 centimeters, 80 centimeters is considered good. And for men, a waist circumference of below 90 centimeters is what is considered healthy.
That's it? Are those the only two parameters, or we should keep something more in check as well?
Well, obviously other things also play a role, but this is a good starting point. If we need to have one measurement, more than the BMI, more than the, sort of overall health picture, as it were, one simple measure would be the waist circumference, and at these numbers, 80 for women, 80 centimeters for women, and 90 centimeters for men, and this is for adults. So typically over the age of about 21 years, by this time, you're sort of fully grown into your adult body, and these are the measures.
And we see a lot of, youngsters that are dealing with obesity as well. Dr. Sharma, would you want to throw some light on that? Young people who are dealing with, obesity. Dr. Gopal here talks about how at 21 years of age, you should start measuring yourself. But I see a lot of cases around me, especially in society in 2026, when we're consuming so much of processed food all the time and so much of fast food all the time. There are young ones that are way below the age of 21 who definitely need some sort of medical intervention.
Yeah, definitely. With changing times and of course our lifestyle, we are seeing patient every day with obesity, with type 2 diabetes. In fact, in children earlier it was the same that if a child is getting diabetic, that is most probably type 1 diabetes. But now we are seeing children 12 years, 13 years of age with type 2 diabetes, along with that obesity as well. And this is because, of course, of their eating habits, because of their sedentary lifestyle. Children just doesn't go out and play. They just keep on watching more of screen time and things like that. Yeah.
So when we're talking about measuring our waist correctly, Dr. Sharma, is there a particular area in the waist? Because the waist is also a vast region. It's not, how should someone measure their waist correctly? Where should, people will tend to go for, the thinnest circumference on their waist. But that shouldn't necessarily be the ideal way to measure yourself. So is there a technical, scientific, benchmark, golden standard way of measuring yourself when we're talking about the measuring tape?
So in order to correctly measure your waist circumference, we should stand straight, we should relax, we should not stoop. Then we should place a measuring tape around our abdomen. That should be at the level of the umbilicus or the navel point. And try not to pull the stomach in, as most people do. And continue with your normal breathing, and at the end of your normal exhalation, you should measure the circumference and try to take at least 2 readings to ensure better accuracy.
So between the weighing scale and the measuring tape, which one is the actual truth teller, doctor?
I would say that weighing scale doesn't give us the full picture. Okay. So we need other markers as well, and waist circumference is one of them.
Okay. Dr. Nautiyal, I do want to ask you why it's so easy to put on weight, weight on the waist area. There are days when I'm just inhaling air and I think I'm packing on more weight on my abdomen. But, before that, we do have these new advanced weighing machines these days that help you understand your BMI. They can give you some more parameters just by standing on a base plate. Are those more accurate, or is that just a marketing tendency? And of course, throw some light on why it is so easy to just increase your waist size so easily.
So regarding the machines you were mentioning, so I think DEXA is the most sensitive. So we are doing body composition analysis by DEXA scans, those machines which are available in the gyms, they are not very accurate basically. So if you want to check your body per total percentage body fat and android to gynoid fat, and in other areas also, the DEXA scan is the best instrument. You should measure it with that. So, and next thing is beyond DEXA scan, which gives you some assumption about your body composition.
Yeah.
Why there is increase in waist size is because whenever you take excessive amount of refined carbs and sugar containing drinks, so all these things just result in chronic insulin spikes, and we know that insulin is an anabolic hormone. So when there is chronic insulin spike, it results in accumulation of fat around your waist. So this fat is not just the subcutaneous fat, it is the fat getting accumulated around your viscera also, that we call visceral fat. So we can measure this visceral fat by doing DEXA scan. So that gives us a better picture basically. You get to know what is inside your body via this simple
Yeah.
scan. And definitely sedentary lifestyle, if you nowadays people are sitting for long hours, unlike
Yep.
previous times, and there's lack of exercise and awareness also that they should exercise more often, and there's stress, then there's poor sleep. So these are worsening these problems because there's a stress hormone cortisol which also favors fat accumulation in around your waist. So all these things are causing excessive increase in the waist size easily nowadays. So people should definitely cut down on their carbs and sugar containing drinks, and they should uh, especially those diet cokes also they should avoid, and they should aim for at least 30 minutes of daily physical activity.
All right. So all those diet sodas, let's avoid all of that. Dr. Gopal, we track our steps, we track our calories, even sleep. Everything's on the smartwatch. But seldom do we take the measuring tape out and really track our waist. And, just like Dr. Nautiyal was telling us, sitting seems to be the new smoking. Sitting seems to be the new problem that we're all dealing with right now. So DEXA scan, it's this new in thing. A lot of athletes, a lot of those sports enthusiasts are going through these DEXA scans. First and foremost, how safe is a DEXA scan, doctor? How many times, let's say in a span of 2 months, can you go inside the DEXA machine about 2 or 3 times to get a better understanding of your bone density, of your composition inside? Because you see, people would advise against going inside the MRI machine or the CT machine because of all the radiation that follows with it. How does the DEXA machine really work, and how safe is it, before we go back to the normal questionnaire?
So, just a little clarification. The MRI actually doesn't give you any radiation. So an MRI machine is actually very safe.
Magnetic resonance. My apologies. I'm not from the same field. My apologies, doctor. But you can clarify that for the viewers.
Yes. So the MRI machine, basically, like you said, is just a shift in the proton vibration. So there isn't any exposure to radiation in an MRI machine. And just to give you an idea, even during pregnancy, if for some reason we need to get some sort of an imaging done, apart from an ultrasound, an MRI machine is considered safe.
Okay.
But coming to, say, a comparison of an X-ray, a DEXA, and a CT in terms of the radiation exposure, the lowest exposure would be with a chest X-ray, where there is just a momentary beaming of an X-ray, that particular radiation for a second. In a DEXA machine, there is an X-ray coming from 2 sources, which comes. So there's a slightly higher chance, but a CT machine is like about 100 by an order of magnitude higher compared to a CT or a X-ray or a DEXA machine. How frequently would you do a DEXA? I think most of us physicians would only recommend a DEXA being done once in 6 months to a year. It's certainly, I don't think any of us would recommend doing a DEXA every 2 months or every month to see if your body fat is reducing. I think a simple tape measure, coming back to what we were talking about, a simple tape measure gives you the best truth. The simplest truths are the best. It may be a hard reality to face that your waist circumference is creeping above what is the recommendation for Indians, but that is absolutely the truth. And like Dr. Sharma was mentioning, do it in the morning on an empty stomach, not immediately after a heavy meal. But be brutally honest with yourself.
So that you can feel good about yourselves.
Yes, be brutally honest, but...
Yeah, be brutally honest. I've also seen a lot of doctors using those calipers, not just the measuring tape. I think the calipers that they use to measure the body mass index, that's another one of those non-invasive, non-radiation ways to understand how and where your body is going. But Dr. Gopal, coming back to the symptoms, when your waist size is increasing, what symptoms or what red flags can you keep in check, can you keep in mind?
Yeah, so sadly, that is one of the reasons why we recommend that people start measuring their waist circumference because absolutely no symptoms occur when the insulin resistance is building up in the body. When the metabolic dysfunction is occurring, absolutely no symptoms. Even when the sugars start to go up in the initial stages, there are no symptoms as with the blood pressure or with the cholesterol. Yeah. So the damage is happening silently within our body, which is why it is so important to keep an eye on this simple measure of putting a tape measure around your waist and checking. And if it's going above the range, nothing wrong with going to the doctor and checking yourself out, checking your metabolic parameters. But what is important to understand is that there are absolutely no symptoms in the initial few years of when you're starting to have the metabolic dysfunction.
Yeah. Dr. Gopal pointed out you have to be brutally honest. So when you're measuring yourself, there's no need to suck in your stomach you can't fool the measuring tape. Maybe you can fool the measuring tape, but you can't be fooling your own self. So we've understood an idea about the symptoms, but Dr. Sharma, throw some light on what kind of diseases come our way, what kind of diseases are linked to increase in this waist size.
So this increase in waist circumference is linked to severe chronic health problems like we mentioned diabetes, then there is heart diseases, increased chances of dyslipidemia, that is abnormal lipid metabolism, then we are having high blood pressure in these people, and fatty liver, of course, it is very prevalent these days. So if your waist circumference is increasing beyond the cutoff, like ma'am said, more than 90 for male and more than 80 for female, then you should consult a doctor and consider getting few tests at least, which includes blood glucose level, which includes your lipid profile, etc.
Okay. If somebody's going to the gym and then there's a lot of social media validation for all the gym selfies that are coming, but secretly beneath all that, spandex, the waistline is expanding. So who do you trust more? Do you trust your social media validation or do you trust your tape? Because, the stress that you're talking about, all of that validation on social media is also busting the stress, isn't it?
Yes, no, me as an individual, I don't believe so much in social media hype and all. But I said, leading a healthy lifestyle, checking your weight, of course, but at the same time, your circumference, and we also go for waist hip ratio, and there's weight to height ratio, and overall, the level of your stress, your overall, if you're leading a healthy lifestyle, then that means more to me.
Okay, so we've established that, having a larger waist is a clear-cut problem here. How soon, Dr. Nautiyal, do you need medical intervention then? Let's talk about how we need to fix this as well. If someone's waist is above the healthy range that has been certified and told to us then the clear-cut parameters by Dr. Gopal and Dr. Sharma, what do you do next? What's the first thing that you start doing? Do you instantly just go to a clinic and speak to a doctor, or is there something that you can yourself begin doing at home, let's say?
So definitely treatment starts at home with your own efforts. So people should focus on balanced, reduced calorie diet. So nowadays we see people go for extreme dieting. They shift on liquid diet basically, which I will definitely not recommend because you cannot follow that for long. So instead of doing extreme dieting, people should focus on they should quit all those processed foods and refined carbs. So mainly they should focus on lifestyle modification. They should increase fiber intake in their meal, add more fruits and vegetables and whole grains. So these all help in cutting down your waist circumference, and they should definitely do regular physical activity. At least the aim is 150 minutes of moderate intensity activity every week.
Is that enough? Is that enough, doctor? 150 minutes, is that enough
for
an entire week?
That is the minimum thing which we recommend. But definitely if you want to lose weight, then you require more. Like that is as per guidelines, it is 300 minutes and 10,000 steps. So that is what we should start from today if your waistline is expanding. And this will decrease the overall fat basically by doing aerobic exercises plus strength training. So the recommendations are to do restraint training at least 3 days in a week and aerobic exercise at least 5 days. So that definitely helps in cutting down your waist circumference. And this change will not start on day one. Definitely, the people should set
Yeah.
a realistic goal. Their aim should be to cut down at least 2 to 3 centimeters in 3 months' time, because the results you see with lifestyle modification is not instant. It takes time. It takes time of approx 3 months to for the results to appear.
That's a great point. And Dr. Gopal, so much of this is instilled within us back at our homes as well. The nurturing, the area, and the social setup that we grow up in. I mean, my personal home, they'd say, "Thoda pet dikhta hai, koi baat nahi, chalta hai." Outside, the society will tell you that it's cute weight. You don't need not worry about it. And then on top of that, you have the late night cravings. I'm not talking about myself, but reducing waist size, Dr. Gopal, does that truly improve health outcomes? What are some signs and signals that will tell a person, okay, you know what, something is working out? I've reduced my waist size, and hey, look and behold, option A has happened. Example B has taken place. I can see this certain something C is happening with me. Can you tell the viewers, what they can be on the lookout for, these positive reinforcements, for the lack of a better word?
Sure. Yeah. So one of the things is that, as was mentioned earlier, Indians are very prone to having a dramatic increase in their insulin resistance, even with a little bit of an increase in the waist fat. And the reverse is also true. So even when we start losing about 2 to 3 centimeters, there is a dramatic benefit. So some of the, obviously, the tangible benefits are going to be evident in blood tests. But let alone blood tests, even your own body will give you clues. So one simple example I can tell you is, for example, young girls studying in the 10th or the 12th standard. You know how kids are like when they're going for their public exam. They are not focusing on their diet. They're not focusing on their exercise. They're very stressed. The parents are stressed. Everybody's stressed. Even gaining a little bit of weight around the abdominal area makes their periods become irregular. And losing that 3 to 4 kilos of weight around the tummy and losing that 3 centimeters will also get their periods to become regular again. But apart from that, cutting down on carbohydrates, exercising regularly, losing that bit of weight, once you re-establish your insulin sensitivity, you start thinking more clearly, you feel less tired, you're sleeping better, your skin will look better. I mean, I think there are multiple benefits. Your joints ache less. When you lose that visceral adiposity, your inflammation comes down. So your joint aches and pains come down. So multiple benefits, even your own body will thank you for it.
Did you say skin will look better? I think that's all the Gen Z needs today, doctor.
Yes, because the acne and all of these things happen because of hormonal imbalances, particularly among young women. That definitely improves once the insulin sensitivity improves.
All right. Dr. Sharma, if somebody sets out on this journey, and it's been about, we're talking about consistency, just like Dr. Nautiyal pointed out earlier, it's not going to happen overnight. You will see the gradual changes. But Dr. Gopal also told us that the reversal is equally dramatic and the benefits are equally dramatic. So what are some common mistakes that people should tend to avoid, or you see your own patients, make these common mistakes time and time over again? Because we've established that belly fat is, a direct byproduct of our lifestyle issues. But do we have some of our favorite foods to blame as well? Some things that we just can't live without. I'll run an extra kilometer on the treadmill, but hey, let me enjoy this hot chocolate fudge now.
See, we need to understand that each body is different and each person is different. One size doesn't fit all. So what is good for one person may not be good for the other one. But in general sense, I can say that avoid eating you, avoid crash dieting or the extreme kind of diabetes. These days, so much of hype in social media. And also, most importantly, stop focusing only on your weight. Once in a while, if you will cheat day, that is fine. And then not just your body gets, you need to monitor other essence as well. Your base circumference, the better as initiator as your body is asked. So in that way, we should try not just the way we should try our base circumference, we should also track our lifestyle and try to achieve the mental fitness aspects.
Well, Doctor, what's worse? I mean, I'm just thinking out loud here, Dr. Sharma. If I'm skipping my workouts, not maintaining that 150-minute benchmark for an entire week, is that worse, or is skipping meals or partaking in crash diets, is that worse? I mean, on the Libra scales, what option is more bad for us?
There is not a perfect scale which can weigh both of them, but of course, if you're on extreme diet, if you're having any other comorbidities, like if elder people, one which is having type 2 diabetes, if that person is also urea, so against with which taking meat and have been on extreme kind of diet, and that can be more dangerous to that person. And about your skipping exercise for throughout the week, oh, okay, if you're not able to exercise for a week, but even then you are maintaining an active lifestyle, like you are walking a lot, or you are taking stairs instead of lift, or you are getting up taking every 30 minutes, 1 hour or so, then that should also be okay, short of.
Okay, Dr. Nautiyal, if there was one thing, one habit that you'd want the viewers to begin from today on, what would that be? From tonight, for their waist, for their heart, for their longevity of health and life, what is that one habit that you'd want them to begin from today?
So they should definitely not neglect their diet. They should have good quality balanced breakfast. Definitely they should not miss, and they should definitely go for an early dinner, like by 7 to 7:30. So that one dietary modification they should definitely do from today. That is the main crux of the weight loss management. That is the diet. First, they have to modify their eating habits and eating timings. So that would I would like to emphasize more on diet, and then definitely exercise plays a role, but the main component and which plays a role is definitely diet. You cannot neglect your diet. You should not skip your breakfast, and adopt a healthy lifestyle and a good diet. Cut down on processed food, and take more home cooked food and high protein, high fiber food.
Okay, so high five diet is the game changer, is the name of the game here. I've got an audience question. Dr. Gopal, would you like to take this one? Ankush here says, can stress and poor sleep, how does that show on our waistline? If we're eating okay, if we're doing everything else that's fine on parameters, how can poor sleep and stress show up on our waistline?
Yes, I mean, I think that's a very important question. Studies have shown that even missing about 4 nights of sleep in a row significantly increases insulin resistance. And these were studies that were done in young, very healthy young men. So a good night's sleep, not only the duration of sleep, but also the timing of the sleep. So going to bed, ideally when it's darkening outside, and waking up when it's sort of the sun is rising outside, helps our hormones remain in sync with the outside world. And that is important. So what happens when you have a late night dinner? Someone was mentioning, I think Dr. Nautiyal made a very important point about the early dinner. When the sun starts setting, all of the hormones in our body realize that we should be going into sort of a sleep and a rest mode. If at that time in the middle of the night you get up and you have like a heavy meal, you've ordered something and you have a heavy meal at that time, the body gets mixed signals. It thinks that the day is starting, that next day is starting. It makes all the hormones that you need during the daytime. So because of this constant conflict between the outside world and our body's signals, that's one of the reasons that contributes to excessive insulin surges, that then contributes to weight gain, particularly around the tummy area. Stress also causes the same problem. Anytime you're stressed, your body lands up making more cortisol, and stress in a more indirect fashion. Stress means that you're not eating right. You tend to stress eat. You eat the wrong things at the wrong time. You're not exercising regularly. So that indirectly then leads to also weight gain.
Well, you went a little philosophical on all of us, Doctor. The outside being in sync with the inside and vice versa. I think that's a great learning curve that everybody should take on. Dr. Sharma, festive seasons, I don't think there's an end to any festive season in our country. It's weddings or festivals, one after the other. And there you come, the good, tasty food that comes with it. You have the cheat meals, and your entire family members, your friends will tell you it doesn't matter, man. It's about one weekend. How do you mitigate that damage? Is there a disciplined way of going about it, or if you've really set forth on that trajectory, how do you mitigate the damage later on that is actually doing to our waist? Maybe we don't want to create panic or strike fear into the hearts of the viewers, but let's tell them about the dangers of what they're choosing to do with their own bodies.
So if you today you're eating one seed, let's say, and the days the calorie you will consume with that sweet, and then you exercise for 1 hour, and then you get to know how much are you burning in the hour. When you get to know the fact of the like that you will understand that even a small cheat meal will lead to just happening of all our efforts that are being doing to work on the body. So we need to understand that we should be persistent enough. One of the way enough moderation we can have a bigger goal, but it should not make it a lifestyle or a habit.
Yeah, I've got another, audience question here. Maybe Dr. Nautiyal can take this one. I mean, this one's quite funny. Say, my waist grows faster than my salary. What can I do to take care about it? Is my belly fat basically my body telling me? I think we've covered most of this, but the waist growing faster than our salary. What do you do in that case? I think that's a dangerous situation, isn't it? Let's not be taking names here, Dr. Nautiyal.
Basically, it's all because of our unhealthy dietary habits these days, which I would emphasize more on the diet part. And definitely, if you will eat refined carbs, then your fat accumulation inside your organs like liver, pancreas will start. So that is something which public should be made aware that by eating these refined processed foods, refined carbs, which are so dense in refined, so that's not unhealthy. Basically, it's unhealthy fat you are consuming. So it adds on to the liver fat and visceral fat. So you should, the money you are telling that it's it's going your, it's more than your salaries, that because they go for cheap street foods basically, which they should avoid. Like you will find a long queue outside a pani puri stall or vada pav stall. So they should definitely stop those. Those foods are very cheap, which are available so easily in this on the street. So they should cut down on those, and they should emphasize on eating more home cooked food. They should eat whole grains, and definitely change their lifestyle eating patterns. Definitely, then only they can achieve a good amount of weight loss if they desire.
Yeah, it seems like from what I've understood is that, it's a mixture of our lifestyle issues. There is so much more that a simple, waist measurement can actually tell you. And our waistline is secretly and clearly keeping a score of all that we're putting inside our body. It tells us exactly what's happening, and that should be the actual starting point of how we can really beat diabetes and actually win life. I'm going to go across the board one last time. It's been a riveting conversation. What's your final message, doctors, to the viewers out there? Let's keep it simple. Let's keep it little educational so that they can take something back home and really work on it. Start with you, Dr. Gopal.
So I'm sorry, I'm just going to be a bit philosophical again. I think all of us have to come together as a society to tackle this. There's no point in us doctors sitting here and telling people don't do this and don't do that. We all have to come together and decide how as a society we can all help each other and improve.
That's a great point. Dr. Sharma.
Yes, I would totally agree. And if you'll say in few words, I would just like to tell everyone, get on, get moving, and try to try to get your lifestyle in check a little bit. A little efforts today will lead to major benefits in future.
Absolutely. Dr. Nautiyal, your final message for our viewers?
So from today's discussion, I think the viewers must be now getting this idea that your waist size is more than just a number, and it is very crucial component of obesity. And they should definitely today check their waist circumference, and because a simple measuring tape costs almost nothing, but the awareness it gives the people to protects their health for years. So they should definitely measure their waist so that they protect their future. So that is what I would like to tell the audience.
All right, then we're going to leave it at that. The waist and the measurement of the waist, such a simple yet such a powerful health indicator. Dr. Gopal, Dr. Sharma, and Dr. Nautiyal, many thanks for taking out the time and speaking to us here on this episode of Samajhdar Bano, Sehat Ke Ishare Samjho. You see, ladies and gentlemen, we continue to talk about all of this because your waist may or may not trend on social media, but it clearly and very quietly is deciding your future. So take the simple steps. You can measure it today. All you need is a measuring tape. Don't rely so much on the weighing scale, a mixture of both. And just like Dr. Gopal pointed out, your insides and the outside of the world, both of them need to be in sync, because the smartest health decisions are actually the simple and the most easy ones. That's all in this edition of Samajhdar Bano Sehat Ke Ishare Samjho. We're going to see you again next time. Many thanks for watching.